The Small Rural Hospital Transition Project, or SRHT for short, supports small rural hospitals nationally by providing on-site consultations and education to bridge the gaps between the current healthcare system and the emerging healthcare delivery and payment system. SRHT works with selected hospitals to identify and disseminate financial, operational, or quality improvement best practices and successful strategies to share with other rural hospital and network leaders. This video showcases the outcomes and successes of a SRHT project hospital that implemented the recommended best practices.
Well, our hospital is a critical access hospital. We have 25 acute beds. We have several outpatient services. We have emergency room services, outpatient surgery, home health, physical therapy, and all of your ancillary lab radiology services. Our community is a small community in rural southeast Arkansas. We are a farm community. We have a high poverty level. We have a low educational level. We have a lot of health issues, a lot of chronic conditions in this area. So getting the resources that our patients need is important.
You know, we're a small town in a small rural area. Our closest larger hospital would be like 43 miles away. So this hospital is vital to this area. So we're very glad to have it, and we're very determined to keep it.
The SRHT project was very beneficial to us. It brought somebody in that had a different perspective, who didn't see the day-to-day operations, and the consultations with the SRHT project allowed us to open up our eyes and see the needs that we needed to work on to improve the quality of care for our patients.
Our SEAL team is unique because it brings multiple people from multiple areas within the hospital together, all at the table to look at issues to help improve the care that we're providing to our patients.
Discharge information and transition of care was one of the stumbling blocks that we had at the time our SEAL team was developed. We looked at our discharge information and how abundant it was to our patients, how hard it was to understand. And so we decided that we needed something that the patient could have to take home, that they could take to their family doctors for a continuity of care and a great transition of care. And out of that came our discharge binders. And it's been very beneficial both to the patients' family members, and also to the primary carers and the specialist doctors.
We have implemented our STAR employee program, which is something that, again, the SEAL team initiated. The STAR employee is presented as a certificate that's in a frame.
It makes them proud to be part of our hospital. And this employee's face just lit up, like he felt like he had won the lottery. He was recognized. We knew he had done a good job. We told him what a great job he was doing. Our chronic care management program, to me, has been beneficial because I have seen a decrease in our readmissions to our facility. We had quite a few elderly patients that were our revolving door patients that would constantly come in, be admitted for a few days, be out a couple of weeks, and then have to be readmitted again. And I think the fact, number one, that they have access to somebody to call whenever needed. Number two, that person they call has access to their family doctor. And I think that having that ability has decreased those patients having to come through our emergency room and be readmitted.
We want to make sure that our patients are not only getting the care that they need when they're sick, but also preventative care that will help them maintain a healthier lifestyle so that they're not sick. So the quality piece of that is important, and there's a whole lot of education that goes with that to the community, the staff, the medical staff, the board, again, all levels of communication. One of the things that we implemented through our SEAL committee were leadership rounds throughout the hospital. Each month we have a calendar that we make out with all of our leadership and members of management, and we make a point to round on certain areas within the hospital every single day and then also round on our patients to make sure that everybody's needs are met. And I then put together a stoplight report, which, so if we were able to resolve those issues, they go in the green. If it's something that we're working on, it goes in the yellow. And if it's something that for whatever reason we're not able to change at this time, it goes in the red, and then explained why we're not able to do it at this time. Also on that report, we recognize staff that whenever we're making our rounds, if someone has mentioned that they appreciate someone or would like to thank someone for something that they've done, that goes on the report as well.
Although we strive within our facility to provide as much care as we can with our patients, we still have to, as a community, come together to help those patients. And so without that buy-in from our community, we don't have access to all the resources that those patients need to stay healthy. By partnering with our community and becoming part of that program, we hope to be very successful in helping those patients to become healthier and have a better quality of life.
We've all grown as a person and as a professional throughout the process. I think it's helped us to realize the importance of recognizing staff for good things that they do. The education that we're providing to those patients to prevent them from having issues and readmissions to the hospital and emergency room visits that aren't necessary. So I think it's really helped us overall to really open our minds to a whole new way to look at how healthcare is delivered.
Instead of the quantity that you see in your facility, we have moved away from that into the quality. It is hard to tell a patient who doesn't feel well that I just cannot admit you to the hospital because you do not feel well. Our patients also struggle with that because of how it used to be versus how it is today. But our doctors do very well with taking guidance with that. Certain things need to happen for a patient to be admitted to the hospital, but they also understand that they can prevent that admission if they do a good preventative program for their patients. They're about keeping their patients healthy as well. And when you have buy-in from the physicians, then that makes our job easier to institute what we need to make our projects better and to help our patients.
The processes that we've implemented from the project have made a really huge impact on the care that we're providing to our patients, continuity between the patients and the staff, employee engagement. We were able to provide a lot of more education to our board. We continue that with our medical staff, our department heads, everybody across the board.
My advice to other facilities is to open your mind to the changes that are occurring and to face them with as little fear as possible, and you can provide good quality of care to your patients with that transition.